But now, for more than 10 years, Camilla Longdon battled with acne. It made her feel so self-conscious that she wore scarves and caps to cover up her face. She wouldn't look in a mirror, have her photo taken, or when it was at its worst, she wouldn't leave the house.
Over the years, Camilla got herself into debt trying out treatments she hoped might help her skin, including one that turned it yellow. Finally, just over a year ago, Camilla underwent a treatment that changed everything. And she joins us now along with our doctor, Chris. Good morning, Chris. Hello, Camilla. So let's just go back before we talk. You look fantastic. I have to say, looking at you now, you'd never think you'd ever had acne. Let's take you right back. This started when you were 11 years old. Seems very young to me.
Yeah, it only sort of started really just very mildly. I mean, I was getting the odd few spots coming up. It didn't really flare up properly till about 13, but yeah, I did start getting them on my forehead and on my chin at 11 years old.
But at that point, you didn't think this was a huge problem, you just got on with it. But by the time you were 13, the puberty time, when we all started getting the acne and the spots, how bad did it become compared to your friends?
Definitely noticeable. I mean, most of my friends didn't actually get a single spot. They were very, very lucky.
Isn't that so annoying when you're the only one with the spot?
Very unfair, but definitely it was very, very inflamed, very red, and the definitely the worst thing about it was the pain. It was very, very painful.
You never think about pain actually with acne, do you?
Is that something that your dad had?
Yeah.
And your sister?
Yeah.
As well, so it runs in the family. At what stage did you think, or your parents think, right, okay, let's go see somebody now, this needs to be dealt with?
I was probably about 15, 16. My dad's very supportive, obviously, he went through it when he was younger, for his teens.
Did he get scarred? Was
He did, yeah. That's where he grew sort of facial hair to sort of hide the scars.
Yeah.
He was very supportive, and I went to see my GP. That's when they recommended me seeing a dermatologist.
And so first of all, what were the treatments? Because we mentioned in the introduction that you had treatments that made your skin go yellow, there were some that smelled terrible.
Oh, yeah.
And for a 15, 16-year-old girl, bad enough having the acne, but also these other complications as well.
Definitely. I mean, the creams I was given various lotions. I mean, there was one particular, I can't remember the name, but it was a yellow, very strong smelling cream.
And during this time, you have to go to school.
Yeah,
with this on,
and also I was looking very yellow and blotchy, and my skin was very angry underneath.
Did any of these things help at all?
Not really. I mean, I started to see an improvement, but then give it sort of 3 months down the line, it would come back up again.
How was it affecting? Obviously, talking about the physical symptoms there, which is dreadful. You know, your face, you can't like a man grow a beard, or how was it affecting you emotionally? Because it's a very emotional time anyway, your teenage years. How was that affecting you in your schoolwork, your relationships with your friends, boyfriends?
I actually was taking time off school. I'd make excuses not to go to school. Mirrors were a real issue with me. Couldn't look in mirrors.
We asked you could you bring some photos in with you, and you said, well, no, I haven't got any. We'd never let anyone take a picture. So there's a whole great 10 years missing in your life because you wouldn't nothing to remember.
No, I wouldn't have my picture taken if there were any pictures and I saw of me. I would cut them up and I've destroyed them. There's literally pictures of me 12 years and then to now. You know, there's a great big gap.
Was it like a depression as well?
Yeah.
It must affect you very badly.
I was crying all the time. I was very down. I mean, once I started work, I was nipping off the toilets, crying. It was definitely very hard.
So then you went to, you mentioned that your GP sent you to a dermatologist, and you ended up with Roaccutane, which is one of the treatments. It got better, but it had a side effect.
It did. Made me 10 times worse depression-wise. I was really, really at a low. I mean, the Roaccutane did help it, but then again, once I came off it, there was an improvement, but then it came back 10 times worse, and this time it was on my cheeks. So it's gone from my forehead and my chin and right up on my
You didn't have it on you, because some people get it.
No, I had a few come up on my chest, my back, but it's always been on my face.
And then also this microdermic sandblasting.
Yeah.
Sandblasting.
Yeah. I then went, I was so desperate, I was using over-the-counter products, and then I was so desperate I went to have facials done. And then I was recommended at this salon to have a microdermabrasion.
This is where they literally sandblast the layer of
and if anything, it made it worse because it just spread the bacteria. I mean, they told me it would help. I believe them. Went for it.
Believe anything about that.
Yeah,
you've got quite addicted to sunbeds, haven't you?
Yes,
very,
very bad. I've done about 3-4 times a week.
But you can understand because it does make your skin look better when you've got a tan.
Definitely.
So, in that case, now I should imagine everybody who's watching is thinking, well, how do you look like you do?
Yeah.
So you discovered a laser treatment.
Yeah.
What did that involve? What did you have to do?
Basically, it was through the private clinic. Basically, I went and saw their dermatologist there. Absolutely fantastic. They talked through the procedure with me. Basically, what it was is the laser kills the surface bacteria and also helps stimulate cell to regenerate, which helps the skin to heal itself. Because obviously, with the acne, I had the really bad red scars as well.
So it sort of stripped the layer down, but also killed the bacteria that were causing it in the first place.
How many treatments do you have to have?
It varies from person to person. I mean, at the clinic, I had just 3 lasers as a course and a chemical peel.
How much did it cost?
£600
each time.
Like that was for the course. That was 3 lasers plus the chemical peel, which I thought it was going to cost thousands. I was very shocked at the price, to be fair.
Yeah. Did you notice the difference quite quickly?
Straight away.
Straight away.
After my first treatment, went home. The next morning, the spots weren't hurting. There was no pain.
What a difference that's made to your life.
Yeah.
Suddenly you're going out. So, Chris, what causes it?
Acne. Well, it's not due to eating chocolate. It's not through having dirty skin. Nothing to do with your diet. It's all driven by male hormones, androgens, testosterone and androgen. And this happens at puberty in girls and boys. Hormone levels are raging. And the high levels of the androgens, some people are very sensitive to them, some of them aren't. It increases the production of sebum, which is the grease, the oil the skin produces, where the hair shaft is. And this sebum increases in volume, so you get a swelling of the sebaceous gland. Dead skin cells on the top of the skin pore block it, so it's blocked, it can't get out, it becomes inflamed, and the bacteria inside there start multiplying, and it becomes infected. So the blockage, we've got some pictures. See, now on that picture there, you've got the red spots, you've got some spots with yellow heads on, they're called pustules, you can see some black heads as well. So you get white heads, black heads, red spots, yellow ones, pustules, and of course, if you don't treat acne, as soon as you can, you end up with scarring.
Now, scarring is the worst thing, isn't it?
It's not just physical, it's mental scarring as well.
Well, Camilla's was extreme. We know that was an extreme form, and she used this NLite laser treatment, which we've got all the details on our website if that's sort of interesting you. Before you get to that, if you have moderate acne, if it's not as serious as Camilla's, what would